Scaling a new startup to enterprise readiness can be challenging. However, we're excited to sit down with alumni and good friends Andy Olson and Krisin Brogaard with Path Fertility, who are making an impact in male reproductive solutions. Hear this episode and listen to their journey in identifying their ideal customer profile and engaging with enterprise-sized entities to lead to their success here today.
Hello, everybody, and welcome to the very first Fuel Accelerator podcast. We're excited to be here. Grace and I have been anticipating this for about 6 months now. So we are thrilled to have you watching us here in Northwest Arkansas. And as a first, we're going to bring on Kristin and Andy, two of the members of the Fuel family that have been so successful here in Northwest Arkansas and abroad that I thought it'd be great to have them on board. So, guys, you want to introduce yourself a little bit and tell them what you do? Because I think Path is a wonderful company. I'm looking forward to hearing about what you guys have been doing.
Do you want to go first, Andy?
Ladies first.
Awesome. So, Kristin Brogaard, I'm co-founder and chief scientific officer at Path Fertility. My background is in the sciences, specifically in epigenetics, which is the study of how our genes are expressed. This is my second venture-backed startup, and I'm really excited for what we're doing because we have set out to raise the standard of care in male reproductive health, starting with fertility, and have made significant progress over the last 6 years now, almost 6 years being since our founding.
Yeah.
I got 2 kiddos and love to spend time outside.
That's great. I can't even spell epigenetics. You want to tell me a little bit more about that?
Yes, absolutely. So this is the study of how our genes are turned on and off. So every cell in your body, from your brain cells to your liver cells to your gametes, so egg cells and sperm, have the same DNA. So the DNA is like the hardware in our bodies. It's very important for our genetic makeup. But what's really important is which of those genes are turned on and off in our cell types, so the specific cell types. So your brain cells need different genes turned on and off than your liver cells. They are very, very different cell types. So it's important to understand not only your DNA, but what sits on top of your DNA. Epi means on top, so epigenetics is on top of your DNA, and it's really what allows your cell types to function properly. And it's very, very correlated to disease. So as your genes stop functioning properly, or ones are turned on and others are turned off that shouldn't be, we have found that leads to diseased phenotypes or diseases and different types of conditions.
Wow. Thanks for explaining that to me.
Yeah.
Andy, what about you? I mean, you're a resident now, aren't you?
Yes. I live in just north of Bentonville and Bella Vista, and I never thought I would be living here. About
this time last year.
Yeah, this time last year, was landing in Northwest Arkansas and going, what is this place? This is an incredible place. So, my background is in molecular biology, did a bachelor's degree in molecular biology and then an MBA, and been commercializing emerging technologies in molecular diagnostics for over 20 years. And I got introduced to Kristin about 6 years ago, and we started this company to really make a difference. And the reason we started this company is I have some friends who were going through fertility treatment. They'd been trying to get pregnant for over 2 years, spent about $80,000 on fertility treatments, and they were diagnosed with unexplained infertility. And that's what caught my attention. It's like, that's not really a diagnosis. That's we don't know. Mm-hmm. And started looking into the problem. And what I found is there was a lot of focus on the female partner. Emily is our friend's name. Emily was going through extensive and invasive testing and treatment, and her husband, Bronson, had just a standard 1950s technology analysis of sperm. How many were there and how many were swimming? And with my background in molecular diagnostics, I was like, we can definitely do better than that. And so I started looking for the emerging technology, and it was in this field of epigenetics. And that's how I met Kristin. There was a software developer who saw what I was working on and knew Kristin from her previous company. And he put the two of us together and said, you should meet. And so we met. And then the rest is history.
It was very serendipitous.
Yeah.
So let's talk a little bit about that history in terms of what Path Fertility actually does, right? What do you guys offer? What do you offer? What is it that you do that makes it so exciting for the rest of the community?
So we know that male infertility is a female health issue. So when men go undiagnosed, if they are infertile but they're missed, the female partner's put through procedures that aren't going to work, and it causes the couples more time and money, but really increases the burden and the testing on the female partner. With the technology that Andy was alluding to, the really old 1950s technology, we know that about 30% of infertile men go undiagnosed. So there's a huge subset of men who are kind of going under the radar in the system, leading to really more invasive procedures on the female partner, and then time and money. So that's really where we come in. We've developed a novel diagnostic for male infertility, where we receive a semen sample, we isolate the sperm from the semen sample, and then analyze the sperm's epigenetics. So we've identified a epigenetic profile that is consistent across fertile men. And now we can measure the deviation from that epigenetic profile, and have found that men who deviate to a certain extent start to become infertile or subfertile, and their likelihood of success in different procedures decreases. So we've really captured a subset of men who are going under the radar. Almost 3/4 of the guys that we diagnose have normal semen parameters, so normal count and motility. So we are capturing this whole new set of men that have gone undiagnosed. And so with that, when there is a male infertility diagnosis, the physician can actually direct treatment paths, because there's no ways that you can overcome that. So we can actually get to a pregnancy more quickly once you have the diagnosis earlier on.
So really bringing diagnosis up to 2025.
Exactly.
Instead of 1950, as you were saying,
That's
right?
exactly right.
That's great. And you guys were just mentioned about a year ago when you first got here. I think that's fascinating. It's been a year. It goes by so fast. Talk about a little bit about what that was like coming here a year ago, and what you were thinking as fuel. We're just getting ready to kick off the next health cohort. So it's exactly the same time a year ago.
Yeah.
What were you guys thinking when you got here?
How are we going to do this? That's what we were thinking. It's like, I had my daughter in high school, her senior year, all of the activities going through that. And this time of year is the beginning of the conference season, all the industry conferences. Kristin's giving presentations at those conferences, like 5 of them in the 10-week period of the fuel cohort. And so we were trying to figure out how we're going to do that. We sat down with our spouses and a calendar all together, and we just mapped it out and figured out when we could be here, when we could both be here, and then when one of us could be here during that 10-week program. And at the beginning, we just kind of thought, should we really do this? We were at a stage in our company where we had some early adopter customers who were using the technology. We had designed a clinical trial to help get the rest of the big networks of fertility clinics on board using the technology. And so we anticipated that we were going to have those results, and we were going to need to be able to convert those clinical trial sites to clinical use. And one of the number one questions that physicians were asking us is, can you get this paid for so that the patient doesn't have to pay out of pocket for the testing? And so when this opportunity came up with fuel and the idea of getting us enterprise ready, one of the ways that patients get their care paid for is through their employer. Yeah. And so we thought, okay, this might make sense for us. The timing was good. If we can get employers to pay for the testing for their employees, then the patients are going to be happier. The physicians are going to be a lot happier, because they don't have to tell the patient, hey, here's this new test. It's going to give us really great information, but you have to pay for it out of pocket. And, and the testing isn't cheap. Like, it's kind of expensive to do this kind of analysis. So it's several $100s that they've got to pay out of pocket to do that testing. And so we kind of said, well, let's talk to some people who have done this fuel program before us And we got recommended to a few founders that had done it before. And I remember we had the first conversation with one of them, and Kristin looked at me and goes, "This sounds way too good to be true." She didn't believe it at all. And then we had the second conversation, and it was more of the same as the first one. And she looked at me and said, "Okay, we got to at least try this.
Got to figure it out."
Yeah. Yeah, we got to at least figure out how we can do this and try it. Because if it is as good as these other two founders said, we talked to a third one too, but I mean, we were just like, if it's as good as they say, we would be crazy not to do this.
Yep, that's exactly right.
Yeah. So a lot has happened since that year, right? You came in, a few things have happened to you guys, haven't it?
Yeah, I mean, one of the things we thought, well, maybe we should delay it a year because we had so much going on. And I was sitting here thinking about if we had delayed a year, we would be starting right now. Mm-hmm. And we would have missed out on so much that has happened over the past year if we had said, "Oh, let's wait till the next one." That would have been, it would have been tragic in some ways. We wouldn't be near where we are today. So do you have anything to add?
I have, some of the biggest things that happened is Fuel did get us enterprise ready. We learned how to pitch to employers who are providing fertility benefits to their employees. And we, since then, I think we now have 33 employers that are paying for sperm QT, which is our fertility diagnostic. We're paying for the male diagnostic.
For their employees.
And it wouldn't have happened. We got the first one out of the Fuel relationships, and then it just built from there. So it has changed entirely the valuation of our company and created a kind of a whole new revenue stream for us.
And also the conversations with commercial partners who are helping us to sell this into the fertility clinics. Our go-to-market strategy is to the fertility clinics. There's about 460 fertility clinics in the U.S. And their physicians and the staff recommend the testing to their patients. But we also wanted to make it available to anybody who finds out about this new testing. And so we do have a website, pathfertility.com. Anyone can go on there and order the testing, and we pair them with a physician if they don't have one that can provide, consultation and insight into the results. And so, as Kristin was saying, now we have employers paying for it, and we have a partner that has 100 more employers that they work with for fertility care, and they're continually talking to their client base about our testing and providing more care for men in the fertility journey. And so that's a game changer for us. The conversations that we have now with commercial partners and potential, acquisition situations for the testing or the company is a completely different level than it was a year ago.
Within kind of the past year that so much has happened, what have been some of the formidable steps or events that have happened that kind of started that flywheel for you guys that's led to such a year of growth and success?
I can think of a couple. It'd be interesting, Andy, to hear what you say. So in our ICP discussions,
ideal customer profile.
Ideal customer profile.
There you go, man. All right. That's what I like to hear.
We really narrowed down who we'd be pitching our company to at these enterprises. And we were given the opportunity through Fuel to present that to a group of, essentially to that customer market. And the efforts that were taken for the development of that talk has changed everything on how I speak to even clinics. But I give lots of talks, and I have really adjusted how I speak about our product and our company because of the preparation from that the ideal customer did for me. And so getting that presentation to where it was, getting the Fuel group was there and worked on it, and there was late night PDFs getting sent back and forth to adjust it. And I think that's really, has really changed how I approach our product, and it has made a huge difference in the conversation.
Yeah, I can speak to that too with commercial partnerships and companies that we're solving a problem that they don't have a solution in their product portfolio for, or bringing to the table some new innovation that can be really impactful for their business. And there was a pivotal week in the Fuel curriculum where we learned about how to do that. First of all, how to get to the level of executives in these companies, and then quickly find out if there's anything that is hitting a nerve with them to where they were like, I want to know more about this. And we have a very clear example of that with an organization that we had been trying to get to the business development group to have a conversation about this. And we employed the things that we learned in the Fuel program in that 1 week. And within like 2 weeks, we got a response from the CEO of that company, who then connected us with the 2 people in the organization who are doing this, like, that need to solve this problem. And we immediately got a meeting that happened like on Wednesday, and then Friday we had the meeting. And we had been trying for weeks. To get to
months.
that. Yeah. Yeah, it was like months to get to that. And so we just looked at each other like, oh my gosh, this works. It's like,
yeah. And that what we've learned from that, I think all of our large commercial partnership potential and kind of our long-term strategies, like we have so much stronger relationships with those individuals from the conversations like that we've had since Fuel because of that really pivotal week.
Yeah. And we quickly determined which companies we should focus on, and which ones there's no, there's no alignment with their strategy, the things they're trying to solve for. It's like, it just helps one of the benefits, the things that I love about the process with Fuel is that it helps, we are constantly looking at this from our lenses and our perspective. And it helps you to understand how all these companies and their executives are looking at things from their perspective. And, a lot of times we lose sight of that, especially as founders and entrepreneurs. You're so focused on the problem that you're solving and what that looks like from your perspective that you don't see how it looks from an outside company that is a potential either partner or customer of that solution.
That's great. You go through the 10-week program. Everybody's got either a funny story, a pivot story, or wow, I didn't expect this within that. And you talked about the week, and I know exactly what week you're talking about. But what's the story that, if you're sitting down with a couple of friends or your partners and you say, yeah, this happened, it was kind of either cool, weird, or whatever. What kind of story do you got to tell about Fuel?
I think I don't know if you're thinking about my story, but yeah. I think we're all thinking about the same story too.
I have one too.
You do have one?
I have one,
what is amazing about Fuel is that they are well integrated into the community. So where do you go? Like, good places to eat all the way to like what gym you work out in. And it's just amazing. And then just the introductions to the mentors that are all local. So you're really integrated into the community. And I was recommended to go work out at a gym and have a yoga class at this gym that was recommended to be really, really integral into the community. And a woman in that class brought me a block because she noticed I didn't have a block in the yoga class. And I thanked her and we started a conversation, became friends in the locker room. That relationship has been pivotal in integrating us into additional employer markets. Because of that friendship I made from a yoga studio of someone who knew about Fuel and knew how important it was to the community. So it was just like, it was a yoga class that, and just being open to the community that really changed a lot of the trajectory of our company. and now have been helped integrate us into other employer benefits.
Yeah.
I will tell you that I've told that story more than once.
Yeah. You never know. You just
never know.
You never know.
And embrace it was something that we talked about when we were like, we're coming to do this. We don't know anything about Arkansas, never been there, and it's going to be uncomfortable. We don't know really anybody. And we kind of talked about this, and we're like, we're just going to go all in. We're just going to go and embrace the uncomfortableness and not, just say hi to people. And
Andy and I are introverts. So it's like, it was a discussion of being like, okay, we have to like throw our personalities out there.
Yeah. That's very surprising. I mentioned before that there's always somebody in the cohort that kind of leads the charge and energy.
Yeah.
And I was going to credit you guys for that for sure.
Wow.
So it didn't come across that you guys were introverts. You guys were very ready to get started and get involved. So credit to you guys on that.
We definitely came in with that mentality. We're like, we've got to put on our extrovert persona and just
go.
Yeah, get out there and do it. And the thing about Northwest Arkansas is that you never know who you're going to meet, and you meet someone and you just, there's a lot of cool people here, and you just start interacting with them, and then you later find out this person is super involved in a huge company in the world, and they're in Northwest Arkansas, and they're having, you're riding bikes with them, or you're doing a yoga class, with them. And so that's a really unique, I've told several people about this place and also about the fuel program. And that's one of the things I keep coming back to is just, you meet the most amazing people.
Yeah. So you guys are still in Bentonville now here.
Yeah.
So then is that part of the reason that you've stayed in the region, or what has kept you here?
Yeah.
And you, Andy, you've moved your whole family here.
Yeah,
so
absolutely.
What draws you to this area specifically for your company, for health tech?
Yeah. So one of the things that was really interesting for us is as we learned more about what was happening here in healthcare, that caught our attention. And again, we finished up the program and we kind of looked at each other and like, we need to stay here and just see what happens as we get involved with everything that's going on here. So in healthcare specifically, there's a very innovative medical school that's funded by significant people and significant funding to approach healthcare in a different way with preventative medicine rather than sick medicine, where you wait till somebody's sick and then take care of them. And people have tried to do preventative medicine for years, and there's just no economic incentives in healthcare to do more preventative medicine and really drive that. And so unless you have someone with significant resources backing that and investing in that. So that was really interesting to us. And then you have other approaches too around whole health. Mm-hmm. Also, the University of Arkansas has institutes and innovation institutes that are being developed, and that all of that in regard to healthcare innovation, unique approaches to it. The technology that we leverage in our company is around, understanding the biology in a unique way, and perhaps seeing which ways you can prevent people from getting sick. And so when we saw all of that, we're like, we need to move here. And I approached my wife about it, and we were in a unique situation because my youngest daughter was graduating from high school, going off to college, and I just brought her out here for 4 days.
Yep.
And when she first got here, she's like, I don't know about this. And then by the fourth day, she's like, okay, I kind of get it. Mm-hmm. I get the community, the interactions that you have, the serendipity that happens, and just the lifestyle, this is a great place to live. So we took the plunge and found a place and moved out here, and we've loved it ever since.
That's great. So if we talk about Path Fertility and you guys, what's the future look like?
Mm-hmm. Well, there's a lot more to do to improve human male reproductive health. There's lots of room for improvement, and we have a pipeline of pretty awesome research in the space to make just incremental steps to really bring some innovation to the space. But there's also, and because of the opportunities out here, Path Fertility has been exposed to the livestock and the bovine space of understanding bull fertility and using epigenetics for bull fertility too, which is it's a really interesting. And we actually, because of what we've learned at Fuel, we got a proof of concept set up with a bull fertility semen artificial insemination group, one of the largest in the world actually, who was interested in our technology. And so we're doing a proof of concept with them to see if we can apply what we're doing in human to bull. And then after that, porcine would be a really interesting next step. So there's lots of room for growth in our technology and bringing new technology to the human space, but also expanding our current technology to other species could be really great.
That's fantastic. Well, I enjoy you guys' company. I see you more often than I see a lot of people. As soon as I come up the stairs over at the Ledger, I see you guys peeking over the glass. It's great to have you here. I will say this, what you're doing is amazing in the health world. I want to make sure that we get the website out there a little bit more to make sure that you guys are being well communicated, because it's really important for all males to understand that they're part of the process.
Yes.
We kind of think we're part of the process, but in the health world, we're not necessarily paid attention to as part of the process. So I really applaud you for what you guys are doing. I am so thrilled that things are going well. I'm glad that you made the decision to come last year.
Yes, me too.
Because right?
Yeah.
Because I think it was really, really great timing for you guys, and so much came out of it. So really thrilled that you're here. Thanks for spending the time with us on our first Fuel podcast. I mean, this is
We love you
great.
guys.
Yeah, thank you.
Okay.
More than happy to. You guys are the best.
Well, we appreciate that. You guys are too.
Yeah.
So for all of you out there, thank you for being here with us. Remember, pathfertility.com. Go out there and take a look. And we appreciate you being here. And we look forward to seeing you for episode number 2. Have a great day.